We are the Chlorpheniramine, an antihistamine H1 receptor antagonist. We belong to the first generation, and in this video, you will get to know everything about us. So, keep on watching! Chlorpheniramine. That's my generic name. My brand names are Allergic, Chlortrimeton, Diabetic-Tusine, Chlortan, Chloramine, Chlormal, Edchlorped Jr., Edchlorped, Edchlortan, Pediatan, Wolfenate, and Allergy Relief. My chemical name is 3,4-chlorophenyl 3-pyridine-2-il propyl dimethylamine. For my drug classification, therapeutically, I am classified as antihistamine H1 receptor antagonist. Pharmacologically, I am propylamine derivative antihistamine. For my pregnancy category, I belong to the pregnancy category B. For my mechanism of action, I bind to the histamine H1 receptor, which blocks the action of the endogenous histamine, which subsequently leads to temporary relief of the negative symptoms brought on by the histamine. Pharmacokinetics. Absorption. I am well absorbed in the gastrointestinal tract. Food in the stomach delays the absorption, but it doesn't affect the bioavailability. Distribution. I am distributed extensively into the body. Drug is about 72% protein bound. My metabolism. I am metabolized largely in the GI mucosal cells and in the liver via first-pass effect. I am primarily hepatic via cytochrome P450 enzymes. Excretion. The elimination half-life ranges from 13.9 and 43.4 hours in adults following single dose in clinical studies, and 10 to 13 hours in children. Drugs and its metabolites are excreted in the urine. Indications. I am indicated for the treatment of rhinitis, urticaria, allergy, common cold, asthma, and hay fever. Contraindications. I am contraindicated in patients having acute asthma attacks. Antihistamines aren't recommended for breastfeeding women because small amount of meat appears in the drug. Must use cautiously in elder patients and patients with increased intraocular pressure, hyperthyroidism, CV or renal disease, hypertension, bronchial asthma, urine retention, prostatic hyperplasia, bladder neck obstruction, or stenosing peptic ulcers. Side and adverse effects. In the nervous system, I may cause sedation, somnolence, disturbance in attention, abnormal coordination, dizziness, and headache. In the cardiovascular system, I may cause palpitation, tachycardia, arrhythmias, and hypotension. In the ocular, I may cause blurred vision. In the gastrointestinal tract, I may cause nausea, dry mouth, vomiting, abdominal pain, diarrhea, and dyspepsia. Hypersensitivity, allergic reaction, angioedema, anaphylactic reactions. Dermatologically, I may cause exfoliative dermatitis, rash, urticarial, photosensitivity. Psychiatric, I may cause confusion, excitation, irritability, nightmares, depression. Hematologic, I may cause hemolytic anemia and blood dyscrasias. Genitourinary, I may cause urinary retention. In the musculoskeletal system, I may cause muscle twitching and muscle weakness. Hepatic, I may cause hepatitis and jaundice. In the respiratory system, I may cause thickening of the bronchial secretions. Metabolically, I may cause anorexia. And others, I may cause fatigue, tinnitus, and chest tightness. Nursing responsibilities. Before the administration, perform a physical examination to establish a baseline data. Assess for possible contraindications and cautions. Assess respiration and adventitious sounds. Evaluate orientation, effect, and reflexes. Evaluate renal and liver function test. During the administration, instruct the patient to swallow extended-release tablets as a whole. They shouldn't be crushed or chewed. Inform patient to store up syrup away from the light, and recommend sugarless candies or lozenges due to the drying nature of the antihistamine that causes a patient to experience dry mouth. After the administration, monitor patient's response to the drug. Monitor for adverse effects such as skin dryness, GI upset, drowsiness, and urinary retention. And monitor the effectiveness of comfort and safety measures and compliance with the regimen.